on social media today of the world capital of Halloween last night. Did anybody see our beautiful city that should have been thronged with young people out enjoying themselves? Every bar and restaurant, every street corner should have been flocked with people. There should have been fireworks and parties and people enjoying themselves to the morning. And instead, everywhere was shuttered and quiet and dead. So this is where we've been brought. My name is Anne McCloskey. Many of you know me, many of you don't. I live and work here in Derry. I've worked in this town as a doctor. I qualified in 1981, which means I'm 39 years in this job. And I'm here today to talk to you just about health. It's the only thing that I really understand. So I trained in paediatrics. I worked in Children's Hospital in Belfast. I worked in Alton, and for the last 28 years I've worked as a GP in Chantal Health Centre in this town, the hub of the universe. And through my work, I was brought up in a religious household, but it's through my work and through my interactions with the people of this town that I have come to understand the sanctity and dignity of every human being, from conception to natural death. And I've been privileged at every stage of that continuum, and I've worked with other NHS staff who shared that ethos. I retired, I took early retirement, and my sons to go into politics. And I was elected to the council here in Derry and Strabane District Council in May 2019. I, however, resigned my council seat a week ago with effect from the 1st of November. Today, I refuse to be any part of an administration which acts against the best interests of its citizens. And I firmly believe that the management of this viral infection by government and health officials acting under the influence of unelected transnational bodies amounts to a betrayal of trust of the citizens. Health. The definition of health is the physical, mental, social, psychological and spiritual well-being of people, not merely the absence of disease or injury. And the NHS was established after the Second World War by the Labour Cabinet, which included Anur and Bevan, to ensure that healthcare was available to people free as they needed it and free at the point of delivery. And in the NHS, the institution which I was so privileged to work for, the government got better value for its money than it could ever have expected, because the ethos that underpinned the people who worked there. Every patient contact, from the professors and consultants to the tea ladies and the cleaners, worked together in harmony to deliver that vision. And that health service was the envy of the world. However, since the early 80s, under both Tory and Labour governments, the NHS has been sold off, sliced up, privatised, reduced, acute care beds reduced, especially in the fields of care of the elderly and in mental health services, and vast swathes of what was once a publicly funded institution are now for-profit corporations, and these public-private partnerships and all the other euphemisms that they use for essentially privatising our most precious national resources. And I stood with nursing colleagues on the picket lines last year, and yes, they were asking for a living wage, because don't forget, our nurses that were clapping on a Thursday night, these are the working poor. These people are not being properly remunerated for the work that they're doing. And the nurses and ambulance colleagues, we stood with them. And they wanted equality and equity of pay with other regions, but more importantly, they wanted safe staffing levels. They wanted support to do their job properly, so that they could look after their patients, not only to offer them first-rate medical care, but to look after them with humanity and respect in all their complex needs. We are 3,000 nurses short of what would be a basic, to afford people safe health care. As of April in 2019, 11% of all posts across the NHS, all nursing vacancies, were unfilled. And a consultant in emergency medicine said in September last year there were insufficient hospital beds in the 6 counties to ensure patient safety. Even in the quieter parts of the year, bed occupancy was nearing 100% and the system was creaking at the seams. Nurses were working unsafe hours, finishing shifts long after they were rostered. And all of these warnings fell on deaf ears. Nothing was done to improve recruitment, to increase resilience or to pay staff adequately, so that when this respiratory virus appeared on the scene, chaos ensued. I've spoken before about the genocidal decisions that were made at the beginning of this epidemic. The movement of 25,000 ill elderly people in need of care from the acute service to die in care homes which were not equipped to look after them, with no PPE, with no palliative care drugs, with no oxygen, and the staff who were absolutely traumatised by what they witnessed and what they were expected to do. The nursing home population are 3% of our population, but they were 30% of the fatalities at the beginning of this year from this viral illness.
Genocide.
Yes, it was genocide.
Murderers!
Then medical support for ordinary illnesses, that is everything except COVID, was essentially withdrawn. And I include in that, to my shame, general practice support. And I'm sorry to say that many GPs still regard patients not as people that they're being cared for and have a moral duty to care for, but as biohazards and as bundles of infection.
We support you!
As early as late April, we knew that 2/3 of the excess deaths during this so-called pandemic were due to the lockdown. They were caused by the government, and that is genocide.
Yes!
Heart attacks, strokes, sepsis, and all these other fatal conditions that take people from this world were left undiagnosed and untreated in the community or in the care home sector. And people were so afraid to seek help because they didn't want to die on their own in a hospital, denied the comfort of their loved ones and the last rites. When I visited many people in their homes, and we talk about NHS heroes, and I have to say that the real heroes very often were families who looked after their elderly loved ones, who isolated themselves for months on end, and who helped them die with dignity outside of the hospital sector. Then we had the changes to the death certification rules drawn up by the Office of National Statistics and, wait for it, the Passport Office. Now you tell me what's that about. And that meant that even without a test, people who died of symptoms which clinically could be considered to be COVID, that is shortness of breath, a fever, cough, could be attributed as dying from COVID. And also a death from any cause where the patient had a positive test in the previous 28 days could be attributed to COVID.
Manipulation.
So, this has never been done for any other illness in the history of medicine. And I believe it was, and is, because it is ongoing, fundamentally and deeply dishonest. I said this here in the Guildhall Square 6 weeks ago. Over there 6 weeks ago I said it, and I'm saying it again today because it's the truth. And we know that globally, when the figures were examined, and largely without the mainstream media comment, which had hitherto reported on every single death, that the numbers were calculated downwards across the world. In the 26 counties there were 1,700 deaths, and these were found only 100 were actually real COVID deaths. The CDC in America said only 6% of their totals were true COVID deaths. 12% in Italy, and so on right across the world. But there were no headlines for these stories. The misery porn machine was silent in the face of disruption of their narrative. Don't pay your license fee! So what's going on in the health service today? We've heard of Dr. Tedros, who's obviously, as we've heard, not a medical doctor. He was the Minister of Health under a totalitarian one-party Marxist state in Ethiopia who covered up famine and disease and human rights violations. And this man had a meteoric rise in that country and eventually was promoted to head of the WHO. He's the man who gave us the mantra, do you remember, February and March, test, 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 and the whole world said test, 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 and they're still saying it. And it's really important, and we've talked about this, and I'm going to say it again today. Cases, that is positive tests, are not cases in the generally accepted medical sense. Cases of disease for doctors are people who are sick. 80% of people who test positive have no symptoms whatsoever.